I have something valuable to say.
I have something valuable to say.
We have something valuable to say.
We are a public body set up way back in 2012 as a result of the Health and Social Care Act and changes that were brought about, essentially to address the issues around NHS and social care. As a Healthwatch, we would give the opportunity to the public to be in the arena with the commissioners, with the regulators and the providers. There was a need to listen to the service user voice to make sure that services for the future are designed at the right time, in the right place, for the right people.
What do you do?
We're here to give members of the public a say on health and social care services. We sit on various boards, networks where we can actually feed that information back into the decision makers. We then go back to the public and obviously show them what difference has been made as a result of them sharing their experiences with us.
One of the things that the Health and Social Care Act gave to Healthwatch was the powers to be able to enter and view any health or adult social care establishment, announced or unannounced, to speak to the people that are using that service, the friends, the families, the relatives and the people who work there, and gather their views and take that information and put that in a report that we can then feed into the decision makers, so again they get a different perspective.
How do people leave their feedback with you?
There's two ways in which we gather feedback really. Either the public come to us, so that can be that they send us an email or we get a phone call. And the other way in which we get people's feedback is we go out to services. So we'll go out and we'll talk to patients as they're waiting for appointments or as they're just coming out, and obviously ask them what their experience has been.
Where does this information go?
All the feedback that we get from members of the public is anonymous, so we don't put names to the comments that we receive. So we collate reports and those are published both on our website, and then we take those to the people who can make those changes happen. People like the Care Quality Commission, the CQC, the Clinical Commissioning Groups, the CCGs, and a number of patient forums.
If a report's gone in and a hospital trust, for example, has responded, they will then create an action plan based on that, and we can then, by attending these patient forums, say how are you getting on with that, how's this doing, what difference has it made. We will send it to the key people within those stakeholders, so a lot of the time it's equality and diversity leads who are wanting to ensure that they're doing everything they can for every patient.
What do you do with these reports?
We get a quarterly report from Healthwatch, and if there's anything that we are doing in particular that we wanted to profile, we would make contact with Healthwatch and say, is there a way that you could help us with this? We then review those and see if there's any learning we can take from them, and that is fed back to particular service directors. Say it was for children's services and we have particular issues that have been raised. We would look at how that we could address that through the commissioning process with our service leads.
When we go out and do quality reviews, there's a lot of data and a lot of information, whereas the Healthwatch report is actually, it's very factual. It's what they found on the day. It's about observations and it's about real life. So we can use these reports to help inform how we want to develop services. A couple of years ago we had a particular ward at Lancaster that was in difficulties. So Healthwatch came in as we were changing the service, and they spoke to staff, relatives, patients and carers. And the feedback we got from that visit actually helped us in sort of being sure that the changes we were making were positive.
Healthwatch's focus is to be there for the people, really. I know from experience that we ask ourselves questions as a result of having Healthwatch on the board that we might have missed otherwise. So, you know, their perspective threads through all the things that we do.
Healthwatch are an independent view, and we really wanted to know what patients thought about the services that they access from the pharmacies in the three areas that we cover. They went into pharmacies and talked to patients about the experience that the patients found, and that was produced into a report which we found was really useful because it was our patients talking about our pharmacies, so we could really get to what we do well, what we could do differently. And it's that information that we can then go and talk to pharmacists and the teams within the pharmacy as to what their patients are saying, what they would like, what they'd like to do differently. They're kind of beating the drum to give the rhythm as to this is where we need to get to, and that then gives people the opportunity to set those standards in an educated way.
My voice has made a difference.
My voice has made a difference.
Our voice has made a difference.